Hi, folks. My name is Jim Grude. I'm with Seniors on Medicare. You want to know why a broker who has worked in the Medicare supplement business for 25 years, when he went on Medicare, he didn't take out Plan F, he took out another one. Give me 3, 4, 5 minutes of your time today, and I'll prove to you why you should not take out Plan F, and if you're already on Medicare, why you should consider getting out of it. One thing we should do first, though, is there's a button up here. Click on the button. It's not going to close this down. What it's going to do is open up another window on your browser. It's going to take you to my website. The benefit for you there is there's some documents I'm going to talk about today that'll be there. And you can stop the video and look at them because you're probably on YouTube right now. And I can't do that on YouTube, but I can do it on my website. All right, there's 3 things I'm going to talk about today. I'm going to talk about quickly the plan that is most similar to Plan F, or why you should consider that. I'm going to talk a little bit about rate increases with Plan F. And lastly, and this is probably the most important thing, what's going to happen in 2020 with Plan F. Big, big change. Okay. As a lot of you know, there's 10 plans on the market today that Medicare authorizes insurance companies to sell. The closest thing to Plan F is what we call Plan G. If you look at the chart, Plan G and Plan F are identical except one area, the Part B deductible. That's $166 this year. Next year it might be a little bit different. All right, well, what would be the benefit of taking out Plan G over Plan F? It's premium, what the companies charge you. Go down on the bottom of the screen and you'll see some graphs of what Plan F will cost in certain zip codes, and you'll see why. You're looking at, on average, at a 65-year-old, about a $300 a year difference in premium between the two. And all they're doing is paying $166 for you. And then guys, at age 75, when you get older, it's huge. I've seen it as much as $1,000 difference. So it's not worth it for you. Secondly, rate increases. You're going to get rate increases. And Plan F historically has gone up 3, 4, 5% more than Plan G. Again, down below, I have some more graphs and some pictures and charts about the different rate increases that Plan F has seen in different states. And it's amazing. I actually have seen Plan G go down in premium, whereas Plan F went up. Lastly, in 2020, Congress, in its infinite wisdom, has decided that Plan F is going to be pulled off the market, no longer available to purchase. If you have it at that point, you get to keep it. But the problem is that you don't want to keep it. No, there's no way. For this reason, Plan F in 2020 is going to be what we call a closed group. If you can look at it this way, you might be with whatever company in the state that you live in, and you have Plan F. That group of people with that company is a group. Okay? As time goes on, people will leave the plan, people will die off, and the group gets smaller and smaller and smaller numbers. Less premium dollars coming in to support the claims. What's going to happen when the company starts having a high claim experience? They're going to raise rates. Now, don't think they're going to just say, well, we can't pass those rates on to our policyholders, we'll eat them. They don't do that. That's not the real world. I'll give you an example. Last week, I had a gentleman call me, age 72, back in 2009. He bought Plan J. Plan J is gone. It's off the market. And really what aggravates me is when he bought that plan, the agent that sold it to him knew that this plan was going to be taken off the market. That's the worst type of agent there is. All right. Now, today, he is paying for Plan J $325 a month. Now, he has some health problems, so I was able to look at all the companies. I work with about 30 different companies, and I can generally find coverage for people. I was able to find him coverage. I couldn't find him the cheapest because of his health problems, but I did find him one. It's going to cost him $195 for Plan G now. So he is saving over $1,500 a year just going by changing. And so, think about the information I've just given you. And there's one other thing I'd like to talk to you about, and it's this. If you're going to go with Plan G or F or whatever plan you're going to go about, there's something that's actually as important of the insurance company and the policy you go with. It's the broker that you buy it through. I have a video on how to buy and who to buy them through Medicare Supplements. It's very, very important, folks. Don't just consider going out to any insurance company that sends you information in the mail and that looks cheap and that looks good price. I'll pay for that. That's not the way to do it. There's a lot of things you need to consider. We do this all the time. I've been working in this business for a long time. My clients, people that work with me, there's no paperwork for them to fill out anymore. I do everything. Everything is done electronically nowadays. There's no claim forms anymore when they work through me. So there's a benefit. So here's my phone number. My website, my email.